Thank you, Srihari. Thank you for the introduction. Friends, welcome back to NRI Samai. Weekend after weekend, we try to bring in people who can help spread awareness about matters that concern to the citizens of our country and people who do extraordinary work for the benefit of society and our people. And my friends, this week is no exception, and the topic of today's discussion is alarming rise in cancer cases in India, and what should a common man know about it. So right now in our country is home to nearly 3 million cancer patients approximately. Top health experts say that India is not yet prepared to fight cancer despite the nation adding about 1 million new patients annually. So the number of cancer patients in India is rising alarmingly, and from year 2020 onwards, our nation will add more than 2 million new cancer patients every year. So to talk about this important topic today, we have Dr. Shabber S Zaveri, a specialist in surgical oncology and head of the Department of Surgical Oncology at Manipal Hospital, Bangalore. A gold medalist in surgical oncology from Gujarat University, Dr. Zaveri brings in years of surgical experience in treating complex cancers. His special skills lies in function and organ conserving surgery for breast, head and neck and extremity tumors. So, Dr. Zaveri, are you on call?
Yeah, very much. Hi, Srikant.
Hi, Dr. Zaveri. Thank you very much. So, Dr. Zaveri, your time is extremely valuable, and I know very well that you're a busy man. It's a great honor to have you on our show today, and thank you very much for coming to our show to talk to listeners, Zaveri.
Thank you. Yep, thank you. Welcome.
Thank you very much, Dr. Zaveri. First of all, Dr. Zaveri, cancer was a really rare phenomenon earlier, and now it has become very common. What do you think has resulted in these staggering numbers of rise in cancer cases, Dr. Zaveri?
Actually, Srikant, cancer is an age-old disease. It's been around since mankind, actually. Previously, patients who had cancer, the word cancer wasn't used that often. So if you find out from your very elderly people in the family, and if you ask somebody who died because of a certain condition, they would just tell you that they had a big something in the stomach and one fine day they just died. So they didn't use the word cancer at that point of time, but it was actually very much existing at that point of time. But what's happened now is with the increasing use of technology and with the increasing media awareness of health, more and more people are being diagnosed with cancers. Now, the difference is that previously cancers used to be diagnosed in a very advanced stage when patients used to become symptomatic. But now the focus has shifted to diagnosing cancers before they produce symptoms. So that's what we call as an early detection of cancer. So it is this new use of new technology called screening for cancers which has resulted in an increased number of patients being diagnosed with cancers.
Oh, very good, very well put. Yeah, it's like the awareness is spread in, and then a lot of people right now, they know the phenomenon of what a cancer is, and that's the reason we see a lot of people talking about it. But earlier, it's just that there are a few people surrounding us, and then suddenly he disappears because he had got something in his stomach and then he died.
Absolutely. Very much.
That's a good way to put in. Dr. Zaveri, can you tell me what are the leading causes of cancer deaths in India right now? It's like when we talk about these staggering numbers, what do you think is the leading cause of cancer deaths?
See, it depends, whether the cancer is happening in the male population or it's happening in the female population. Among the male population, the most common cause of cancer is usually exposure to cigarette smoking and tobacco in any of these forms. And in ladies, the most common cause of cancer is probably what is known as a human papillomavirus infection, which affects the female genital tract. So these are the two most common causes for cancer in India. In males it is tobacco related, and in females it is usually HPV related.
Oh, okay. So you mentioned that it's like HPV related is something. Is it tied to the cervical cancer that we talk about?
Very much, absolutely.
Oh,
It's
okay.
not only the cervical cancer, but it also affects, the area called as the vagina and the vulva. So it is the lower genital tract which is affected by the HPV virus.
Mm-hmm.
Also it's been seen now that HPV viruses also lead to an increased number of oropharyngeal cancers, that is cancers happening at the back of the throat
Mm-hmm.
and in the voice box area, that is called as the larynx and hypopharynx. That's where the voice is produced.
Okay.
So HPV related cancers are now becoming common even in the head and neck area, apart from the female genital tract.
Oh, okay. Dr. Zaveri, as per these studies, it's found out that rural women seem to be very prone to these cervical cancers in India. Can you explain what is a little bit, as you have already explained it, but I wanted to really bring out a good understanding amongst, if possible, that what is the cervical cancer and why is it more phenomenal in the rural women?
Absolutely. See, Shrikant, is a very good question you brought out. See, now in rural areas, it's known that cervical cancer happens in areas of low socioeconomic status, that is probably the village and the smaller places. And it's also related a lot to personal hygiene. Now, what we know about this human papilloma virus infection is it's usually caused by sexual transmission. It's a sexually transmitted disease, essentially.
Oh, okay.
So, probably, I wouldn't like to say it, but probably it is more common in villages. It's very surprising, but I think that could be a fact.
Okay.
So, it is the level of personal hygiene. And most of the times, these HPV infections are transmitted by males.
Oh.
Okay, so it's a usually a promiscuous society probably, which could be leading to this problem. Now, what you see is as the socioeconomic status improves, the incidence of cervical cancer decreases. So, in the cities in India right now, in all the four major metropolitan or cosmopolitan cities, it is not the cervical cancer which is the most common cancer. It is actually the breast cancer which is more common. Now, conversely, breast cancer is less common in rural areas. Okay, so this is the shift we've noticed in the epidemiology of female cancers. Cervical cancers being more common in the rural area, probably due to personal hygiene as well as sexual transmission of this disease, of this virus. And in the urban areas, females are more prone to develop breast cancers.
Oh, wow. Okay, this is something new to us. So, you brought up this discussion about breast cancer. There's some kind of myth. It's like I can get more insight from you. Is when we talk about breast cancer, is it only related to females, or it is possible that men also can be prone to breast cancers? Can you throw some light on that?
Yes, Shrikant. I think that's a very, very good or a very valid question you asked me. It is said that breast cancer happens. The incidence of breast cancer is 99 in women and 1 in males.
Oh, okay.
So of every 99 ladies who develop breast cancer, 1 breast cancer will be found in males. So, and we have seen and we have treated a lot of patients with male breast cancer. Now, the belief in society in general is that males don't have a breast, and so they wouldn't develop a breast cancer. Males do have a breast, but it is a rudimentary organ in males. And it is, a male breast cancer is more easily diagnosable at an early stage because they would present with a lump, and since the breast is a very small rudimentary structure in the males, one could easily feel a lump under a nipple areola complex or somewhere in the vicinity of that, especially while taking a shower. So usually the male breast cancers, even though they should be diagnosed early, males tend to ignore it, saying that, I'm a male and I'll never develop a breast cancer, so they don't go to a doctor for that reason. And it's basically presented to us in an advanced stage when the tumor has spread into other parts of the body, and this is the fact.
Wow. Okay. So it's highly possible that a male can develop a breast cancer.
Absolutely. And one of the features of breast cancers, be it a male or a female, is that 95 out of every 100 breast cancers are painless to start with. I mean, they absolutely have no pain. It's just present as an innocuous, lump, a painless lump in the breast, which people tend to ignore. And, they wait for something to happen, either an increase in size or some changes in skin or, pain developing in that or something like that, till they, go to the doctor. And most of the time, since it is painless, it's just passed on as, okay, it's a lump and probably I'll wait for 15 days, maybe I'll see it again after 15 days and then probably I would go to my doctor. And this cycle keeps on happening and, they then present to the doctor when the disease has, been advanced.
Oh, okay. I got it. So, Dr. Zaveri, I've been getting some messages on Facebook that your voice is a little low. Can we get closer to the mic if possible?
Yeah. Now is it okay? Now can you hear me?
Yeah, a little loud, and then I think it should.
Okay.
Now, if I hear any feedback, I'll let you know, Doctor.
All right. Okay.
Now, so in the simplest way possible, of course, we should have begin with this very basic thing. In the simplest way possible, how does a cancer begin? If you could just enlighten that, I think that will answer most of the questions. How does it begin in the first place?
Okay. See, cancer basically is a genetic disease. It starts with an altered gene in the nucleus of a cell in any part of the body, and that particular cell is unable to repair that gene defect. So it becomes a defective cell. And when that cell multiplies, it gives rise to another defective cell. And these, has a sort of a progression, like one cell becomes 2, 2 becomes 4, 4 becomes 8, 8 becomes 16, and it increases in size and it increases in its progeny. Now with every reproduction of that particular cell, the genetic alterations become more and more. And the cell is then considered to be an abnormal cell, which doesn't, I would say in a very common language, it doesn't mingle around with the normal cells surrounding it. So it becomes a sort of a rogue cell. So there is something called as an intercellular talk. Cells talk to each other by way of some sort of a hormonal milieu within them. So these particular cells which have the genetic alteration to grow aberrantly, they don't listen to the normal cells, surrounding cells telling them, okay, please stop, we don't want any of you anymore. So these cells become rogue cells, and then they start multiplying, and they start invading that particular organ, its surrounding organs. Then it tends to, go into the bloodstream, it tends to go into different parts of the body, and it seeds over there and it starts growing. And this is how one cell becomes a cancer cell. Basically, it starts with a genetic alteration. That's how it begins with. And this genetic alteration usually is due to some form of a stimulus. And now, tobacco acts like a stimulus. So, or sometimes when people have sharp teeth in their mouth and they repeatedly bite their cheek, what we call as a cheek bite, due to constant irritation of that area, that particular cell will try to repair itself, and at some point of time, it becomes a genetic change within them. So then, that's when cancer can usually form. Same thing happens when an HPV infects the cervical area. It will go and integrate into the DNA of the human cell over there, and then produce a DNA change, which is going to be a cancer. So it won't listen to its surrounding cells, and it just keeps on multiplying on its own. So that's how a cancer usually begins. It needs a stimulus, and then that stimulus is provided. So we know there are certain agents which cause stimulation, which lead to production of cancer. But majority of the times, we don't find a stimulus. But certain common cancers we definitely know, like exposure to sunlight, especially in certain places in Australia where there is a defect in the ozone layer. Ultraviolet radiation leads to production of skin cancers. We know very well that the cause is an ultraviolet radiation, overexposure to ultraviolet radiation. Then smoking causes tobacco. That's also very well known. And chewing of tobacco products causes oral and oropharyngeal cancers.
Right.
So this is and there is one particular type of cancer which is peculiar in India, which usually happens in the north, in the Kashmir area, where people in order to remain warm, they usually keep something called as a kangri. It's a sort of a heated pan, which is heated with charcoal. So these people place it near their abdomen, in front of the abdomen, to keep themselves warm.
Oh.
And they put a blanket over it. And that, due to the constant heat produced over there, the skin of the abdomen becomes cancerous. So that then we call it as a kangri cancer. It's a very peculiar thing happening in India.
Wow.
So it all depends on place to place.
Wow. Kangri cancer is something that is, I think,
it's basically unheard of in other parts of the world, but it is quite, it's one of the unique forms of cancer happening in the Kashmiri population.
Oh, okay. Okay, this is very new. So, doctor, I was wondering, after all these medical enhancements that we see, today there is a feeling that cancer could be cured, and that cancer is no longer a killer disease. We because of this lot of media coming up saying that there are multiple cancers that can be cured. But what is the truth in this? Do you think cancer is a curable disease?
Shrikant, the majority of cancers are curable. There is a saying that cancer is curable if detected early. There is always a rider. So if the cancer is detected in an early stage, it can be cured. But there is one thing I'd like to tell our listeners, that always never treat medicine like it's 100%. You never get 100% results in anything, because human body can behave differently, and every human body is unique. It responds to stimuli differently, and and similarly cancers. Okay, if you have two types of similar cancers in two individuals, and let's say that both their cancers were detected early, for example, a very early stage breast cancer, and the morphological features of the cancer is very similar with respect to how it looks like and the other criteria. But what happens is, one lady would probably never have a recurrence of cancer, whereas another lady who had a similar type of cancer would have a recurrence and probably die of the disease. But that happening is very less when the cancer is detected early. But surely if you come to the doctor with an advanced stage cancer, or something called as a locally advanced stage of a cancer, then cure rates really drop. So then this is when we say that cancer becomes a chronic disease. So cancer is something which is a chronic disease. It's something like rheumatoid arthritis or diabetes. Once it's there, then it's, it is at some point of time, it may come back, and that's the reason why we say that once a cancer patient has been cured, he needs to see the doctor for the rest of her life or his life. So that if at all there are symptoms or signs of recurrence, these can be diagnosed early, and appropriate treatment may be instituted, so that the patient lives longer.
Oh, wow. Okay. So, Dr. Zaveri, it's like we're using a very common terminology called cancer. When we in our conversation, we talked about throat, we talked about breast cancers, we talked about multiple things. Looks like cancer is not one disease, but a lot of diseases, if we're talking about, because it impacts multiple parts of our body. In your experience, what is the most common form of cancer you've come across, doctor? This is a very genuine question, might be.
Yeah, see, I'll tell you this, Shrikant. See, when I was doing my training at the Gujarat Cancer and Research Institute, Ahmedabad, this was during 1998 to 2001, the most common cancers which I used to see there, because that is something called as a regional cancer center. Okay, so in a regional cancer center in Ahmedabad, the most common cancers which I would see used to be head and neck cancers. That is, cancers arising in any area of the head and neck, and most of these cancers, over 90% of these cancers, were associated with tobacco abuse. So in men as well as in ladies, it used to be quite common over there to have head and neck cancers. Okay. Now, when I shifted back to Bangalore, and once I was associated with Manipal Hospital, now since it's an urban area, what cancers I started seeing here were breast cancers and gynecologic cancers, most commonly ovarian cancers and cancers of the uterus. Now these became more common, And also, because of the spicy diet in South India, we also see a lot of upper gastrointestinal tract cancers, like cancers of the esophagus and cancers of the stomach. So these are the cancers which are more common in the south of India. And in the north, especially in the northwest, it is tobacco-associated cancers. When one shifts focus to the east of India, that is towards eastern Uttar Pradesh, Bihar, and West Bengal area, gallbladder cancers are very common. It's all geographically distributed.
Wow.
So there is something in the environment which leads, or some habits of certain individuals or a group of people, which is causing an increased incidence of cancer in that population. So this is what the statistics tell us.
Fantastic way to put in. Wow. Friends, we are in conversation with Dr. Shabber S Zaveri. For those of you who missed our earlier conversation, Dr. Shabber Zaveri is a specialist in surgical oncology and head of the Department of Surgical Oncology at Manipal Hospital, Bangalore. Dr. Zaveri is a gold medalist in surgical oncology from Gujarat University and has got loads of experience, surgical experience in treating complex cancers. Dear friends, if you, as you all are aware, that any of our NRI Samai shows that we do are put in archive in youtube.com/NRI Samai. So you can still hear to our shows once the show is done. Right now we are in conversation with Dr. Shabber S Zaveri, and Dr. Zaveri has been enlightening that it almost looks like in India people pay money to become a cancer patient. So mostly in rural areas, it's rising consumption of tobacco products such as gutka and other things that are contributing to a lot of cancer issues. And looks like in urban areas, as Dr. Zaveri was saying, that people's unplanned daily routines or might be some kind of food habits or the lifestyle results in these kinds of cancer issues. Okay, coming back to Dr. Once again, I wanted to really understand what are the kinds of treatments that we can look at if a cancer is detected?
Okay, Shrikant, I think that's a very good question. See, usually we say that once a cancer has been diagnosed, majority of cancers are treated by what is known as a multimodality treatment, what we call as a multimodality therapy. Okay, now cancer is essentially treated with three modalities of treatment. The basic modalities of treatment are surgery, radiotherapy, or chemotherapy. Okay, so these are the three main armamentariums which an oncologist has got to treat cancer. So we would divide tumors into solid tumors or hematologic malignancies. Okay, solid tumors are majority of the cancers which affect solid organs like breast, brain tumor, breast tumor, lung cancer, bone cancer, soft tissue sarcomas, pancreatic cancers, gynecologic cancers. So these are all solid tumors. Okay, so in solid tumors, it is usually a multimodality therapy which is used to treat cancer. So it is just that the sequence of these treatment may differ from organ to organ and from stage to stage. Whereas in patients who've got hematologic cancers are nothing but what we call as leukemias or lymphomas. They affect the blood system, the blood production cells in the bone marrow. Okay. So these are called hematologic malignancies. In hematologic malignancies, there is generally very limited role of surgery. But definitely there is a lot of chemotherapy and or radiotherapy which is involved in the treatment of these hematologic cancers. So we will restrict ourselves to treatment of solid organ cancers, okay, solid tumors like for example breast cancer, etc. And majority of these are treated using a multimodality therapy. And as I told you, Shrikant, that it depends upon when you come to the doctor, at what stage your cancer has been diagnosed, which particular organ in your body is involved. So then all the oncologists of the respective branches, that is surgery, radiation, and the chemotherapy specialist, what we call as a medical oncologist, then they sit together to discuss the particular patient's case, the particular patient's problem, and then arrive at a particular plan of treatment as to whether this patient will require all three modalities, and if it requires all three modalities, then in what sequence this modality has to be instituted. Okay, so this is something called as a multidisciplinary management.
Okay. So it seems like you've brought in three different ways of treating it, out of which the most prominent things are. First thing is probably if it's very low sarcomas or whatever it is, you treat with surgical procedures.
Absolutely.
And the other thing is radiation, that you have radiotherapy, which you're talking about, and the other one is
Yes.
chemotherapy. So if I have
Chemotherapy, yes, absolutely. Chemotherapy, or what we also call sometimes as biological therapy, because as of now, a lot of research and a lot of new drugs are out for treatment of solid cancers and even hematologic malignancies using new biological therapies, which are not chemotherapies, but these are usually orally administered drugs, so which the patient can take in the form of pills.
Mhm.
And the side effect profile of these particular drugs are so different from chemotherapy that it's a new class of treatment which is being added to oncology.
Oh, okay. Very good. So, Doctor, we have Pradeep Kumar Pratipati from Machilipatnam, India. His question to you is, in India, more than 2,000 persons die every day, and about 8 lakh people die every year due to tobacco-related diseases.
True.
As you're saying, Doctor, and how we can control, and what are the steps taken by government to control this? Do you have any insight on this?
Okay, I'll tell you. See, tobacco-related cancers are one of the most common causes of death. Cancer and cancer death, especially in males. Okay.
Mm-hmm.
So, unfortunately, we are all aware that the major source of revenue for the government comes from these tobacco industries.
Okay.
Okay. So the government is unable to completely stop. I don't think there is any country in the world where tobacco products are not sold. But surely, what the government has done now is they have put in some very bold pictures of a crab and certain mouth cancers on covers of certain of cigarette packets and the gutka packets.
Mm-hmm.
So that even a person who is not educated, if he sees this packet and if he sees these ghastly pictures on that,
Mm-hmm.
he would think twice before doing it.
Okay.
Before consuming that thing. So that's one way the government is trying to control the menace of this tobacco-related cancers.
Oh.
The other way the government is doing it is that, see, most of the times if you see this the tobacco habits are common in patients with low socioeconomic status. So trying to make availability of gutka products is an issue. That is number one. Number two is increasing the taxes on these gutka products or the tobacco products, so that it is difficult for a person within a low socioeconomic class to get access to these products. Okay, so that's another way of trying to control the tobacco. The third the third thing which we see very commonly in, at least in Bangalore, what I see is that within, if there is a school, there is a particular radius of about 200 meters or something like that, around which, nobody is allowed to sell tobacco or its products.
Ah, good.
So that, because this habit of tobacco falls, it starts in the later aspect of schooling. That's when people, the teens get addicted to tobacco. So the government is also trying to, stop the sale of tobacco within 200 meters or 300 meters of a particular school, so that it's not easily accessible. And see, unfortunately, the hard fact of life in India is that in India, cancer doesn't rank among the topmost causes of death and topmost, it is basically certain common illnesses. See, people in India are yet dying of tuberculosis, they are yet dying of malaria, they are yet dying of dysentery, diarrhea, typhoid, so these are called communicable diseases.
Right.
All right. So the government has to spend majority of its health budget in dealing with these particular conditions which involve the common man.
Right.
All right. So it has to balance its funds for these diseases as well as it has to manage its funds for cancer treatment. Unfortunately, there is no public awareness programs in India, or there are no screening programs in India where the government is trying to screen populations which are at risk for cancer. So whichever people come to hospitals for screening cancer, they do so either by watching television or hearsay from their friends or relatives, or surfing the internet, and then they would say, okay, they would relate their particular symptom, oh, this could be a cancer, and then they would come to the hospital. But unfortunately, the government itself, I don't think, is doing too much to increase awareness of cancer and its early diagnosis. That is the unfortunate thing, but that's very, very true.
Absolutely true, Dr. Zaveri. I'm sure, as you said, government initiatives will definitely help a lot of our citizens know about this problem. I think if I don't have the full information yet, but I've recently read somewhere that Kerala government has imposed a ban on tobacco, but I don't have full information on that. I'll have to really dig and evaluate if there's the full information about it.
Okay, Shrikant, I am not aware of the Kerala government banning tobacco.
Oh, is it?
I'm really not aware.
Yeah, me too. It's like I just read the headline and then I turned my pages up, so I think I'll have to really get into that. And Doctor, you're mentioning about taxation or putting in imposing some kind of tax that will basically reduce the access to the low-income population to this tobacco and other products. On the same lines, I wanted to ask you, I was wondering that how this equipment, the medical equipment that is needed to treat cancers is definitely one of its kind, right? So what kind of medical equipment do we have in our country right now, and how easy is it to import good equipment from other countries? Because the other countries, there are a lot of good equipment that is there. That's something that we hear about. So do you think the government has taken some steps to import some good equipment and it has reduced the duty taxes or whatever on these equipments?
Shrikant, first of all, is that access to technology is in India is as good as what it would be available in the United States. I think majority of the times whatever is there in US finds its way to India in a very short period of time. So we don't have the technology lag between US and Europe and India. Second thing is that you don't really actually need a very sophisticated equipment for treatment of cancer, because the only thing which I would say is which is unique to cancer treatment is radiotherapy. Okay, so radiotherapy machines are ones which are accessible, and they can very easily be imported, and there is definitely a reduction in the import duty when a machine is imported into India, and that is especially true if it is going to be used for public use. For example, if a government a medical college or if a government organization is importing a particular machine, then the government definitely decreases the taxes on that, so that it is used for the treatment of common people in that particular society.
Okay.
Okay. So that is around, and that happens. The other thing is that when we come to chemotherapy, as you're aware that most of the chemotherapy drugs are being discovered in Europe and USA by the multinational pharmaceutical companies, who once discover the drug and then they have a very high price. The molecules are at ridiculously high costs. So if the same thing was to be used in India, I think the chemotherapy would not be affordable for maybe over 90% of the Indian population. So what happens is that the Indian companies, the Indian pharmaceutical companies, want to produce the same drugs at India at a cheaper cost, which is more accessible to the patients at a cheaper rate. But unfortunately, majority of the times, there is a court case going on, and by the time that court case is dismissed against that particular company, so many years have passed, and so many people who would actually have benefited by taking the drug would have died because of the disease. So that's something which is quite worrying, as the cost of chemotherapy when it is brought to India. So that is something which probably the government is working on right now. And recently, there was a newspaper article about the Indian company called Cipla and Natco, which were drastically reducing the cost of drugs to make it very affordable for the Indian population, especially for a drug called sorafenib, which is originally manufactured by Bayer company of Germany. So the cost used to be something like 2.5 lakh rupees per month for treatment, and this particular drug was used for treatment of kidney cancers and liver cancers.
Wow.
But there's an Indian company called Natco which fought against this, and they brought down the price of that particular drug from 2,50,000 or something right down to something like 8,000 or 9,000 rupees. So that's a huge difference in cost, isn't it?
Absolutely.
So you can imagine how many people who initially couldn't afford that particular drug are now being able to afford that particular medicine. And so this is something which is happening all the time.
Wow, this is great news, doctor. This is really great news. Yeah, and can you touch up a little bit on Cipla bringing down prices? It's like a drastic increase in price.
Cipla has even brought down the prices further. Like if Natco is probably selling the drug at 8,000 rupees, Cipla is now planning to sell the drug at 5,000 rupees, and that is only one of the drugs. It's also brought down the cost of chemotherapy of a lot of other chemotherapeutic drugs. So it is basically being afforded by the basically the poor people who actually can't afford the costly drugs which are being imported into the country. So I think certain companies are doing a great job in helping the common people access and affordability of cancer care.
Oh, excellent, excellent. I've just been browsing here on other things as well. I'm seeing that India is a rare country in a sense that it imposes 11 to 20% customs duty on imported cancer medical equipment. This is something that I'm reading just now on web.
Correct.
So while these items actually deserve great incentives, do you think we have the necessary to import cancer medical equipment, and then the government should reduce the prices of reduce the custom duty on these equipments, doctor? What do you think?
They should definitely reduce the custom duties on things which are being imported, because ultimately if you have a healthy population, the country is healthy. So if you're going to make healthcare expensive, obviously people are not going to afford it, and there will be a lot of people sick people, unhealthy people in the community. So obviously the government has to bring down or cut down the excise duty or the import duty on certain essential medications which are used in treatment not only of cancer but also other diseases.
Wow. Okay. Dear friends, we are live with Dr. Shabber S Zaveri right now, a specialist in surgical oncology and head of the Department Surgical Oncology, Manipal Hospital. And it's a fascinating discussion, my friends. And Dr. Shabber S Zaveri is a gold medalist in surgical oncology from Gujarat University. And Dr. Zaveri brings in surgical experience in treating complex cancers. So I'm sure a lot of our listeners are getting awesome information from Dr. Zaveri. So Dr. Zaveri, we've been talking about the import duties and other things, which is really a good piece of information. I have one of our friend here. Let me check back. His name is he's Pradeep back again, and he's saying the fruit from graviola tree is miraculous natural cancer cell killer, 10,000 times stronger than chemo. Is it true, doctor?
See, I have read some newspaper reports as recently as last week about this graviola fruit extract. But see, obviously, if you go into the history of anti-cancer treatments, okay, especially of chemotherapy, a lot of these molecules have been discovered from plants. Okay, so there's a drug called paclitaxel, which is widely used in treatment of breast cancers and ovarian cancers and etc. And so this particular drug was extracted from a tree called the Pacific yew. Okay, so it was from the bark of this Pacific yew. So obviously this plant, what Mr. Pradeep is talking about, that graviola, must be having certain anti-cancer properties, and probably it is just a matter of time till somebody discovers what that anti-cancer molecule is, and I'm sure that it is going to come out as some form of a new chemotherapy discovery at some point of time. It's because most of the cancer drug discoveries have happened like this. either it's from a fungus which was isolated and it was shown that it had anti-cancer properties, or it's a plant. We know that as of now that a lot of anti-cancer drugs are extracts of certain plants, and which are then synthesized and purified and then sold as chemotherapy. So Mr. Pradeep would be right in saying that it does have miraculous anti-cancer properties.
Okay. Dr. Zaveri, we have a caller live on air right now. Sir, please mention your name and go ahead and ask your question to Dr. Zaveri, please.
Dr. Zaveri, thank you for coming on the air. My name is Srihari from Los Angeles. I would like to ask suppose heart disease or all these other problems, we know exactly. They are very specific, but cancer seems to be pretty wide. It can happen anywhere in the body. So why is it so different? What is that different about the cancer? And second question is about the skin cancer. So whenever we go out in the sun, how cautious should we be? Should we be putting on a lot of sunscreens? I know it's
Okay.
Is the skin cancer higher in lighter skin, or is it all same?
Okay. Thanks, Srikar. I'll just answer your first question. Why? See, your first question, I assume, was that for heart ailments, we know what are the risk factors like diabetes, cigarette smoking, hypertension, type A personality, etc., etc. But in cancer, what are those things which can lead to cancer, and how can how cancer is different from heart ailments? Okay, let's start off with the common thing. Like, both are chronic diseases. Heart disease, diabetes, cancer, they're all chronic diseases. Now the problem with cancer is a very heterogeneous disease. Okay, and it can involve any part of the body, right from your scalp up to the toe, and any organ in the body can be involved with cancer. So there is no one specific etiological agent or causative agent which you can say that yes, this is going to this is going to definitely lead to cancer in this particular person. And most of the times cancer begins without symptoms, and once symptoms are produced, it usually means that the cancer is advanced. Okay, so that's the first question. Second thing is about your concern about exposure to sunlight and development of skin cancers. It is true that skin cancers is more common in fair-skinned individuals than in the darker skin individuals, and there are certain regions in the world where skin cancers are more common. And we know that skin cancers are most common in Australia, especially in this place called Queensland, because of the huge ozone defect which overlays that particular region. But obviously, moderate exposure to sunlight is actually good because of vitamin D production. Sunlight helps in vitamin D production. And what we would say is that the peak time of radiation due to sunlight is between 10 a.m. and 4 p.m. in the evening. That would be true for India, but I don't know, how it works in the US, because at different seasons you may have long days and short days also. So it is usually said that sunlight exposure towards the evening is worse than sunlight exposure during the mornings. And obviously, if you are going to be exposed to sunlight for a long period of time, it is always better to apply a sunscreen with a proper protectant factor of at least about 25 and above to prevent the development of these skin cancers, especially in sun-exposed areas like the face, the hands, the neck.
Yeah. Thank you, Srihari. Thanks for your question. And Dr. Zaveri, I've got one other question here, and sorry that I don't know who the listener is here. Women who prefer late childbirth and hate to breastfeed are particularly vulnerable to breast cancer. Can you explain the realities or facts behind this, Dr. Zaveri?
Okay. Whenever there's any cancer which is happening, like for example breast cancer or any other cancer, we try to associate what caused that particular cancer. So we ask the patient a couple of things in their history. The most common thing is what we ask them is, at what age did you have your first child? So the statistics says that if the first childbirth is delayed beyond the age of 28, then there is a statistical more risk of getting breast cancer. Also, if a woman is nulliparous or has never given birth to a child, the relative risk of developing cancer in the particular individual is very high. Now, what I mean by this is that if below the age of 28, a woman had her first full-term pregnancy and delivered a child, what it does is that it causes maturation of certain things called terminal duct lobular units within the breast. So that matures when a woman gives a birth, especially before the age of 28, to a first full-term pregnancy. So this is something which protects against cancer, maturation of the terminal duct lobular units within the breast. Now, after the age of 28, they say that this protective effect is lost. Mm-hmm. So that's the reason why it is said that multiple pregnancies, especially pregnancies happening before the age of 28, are protective against breast cancers.
Okay. Very well said. Thanks, doctor. And thank you for that question. And Dr. Zaveri, let's come back to this question on cell phones. And it's there's a lot of buzz in the tech community who are worried that these cell phone radiations are causing cancers. What's the update on that, doctor? Do you have something to share about the cell phones and its relationship to the cancers?
See, there were certain reports that using excessive use of cell phones could lead to brain cancers developing, because the area of the body where it's used is basically the ear, and the brain is very close to that. Now, there are certain reports also saying that there is something called as an acoustic neuroma, which can happen more commonly in people who excessively use cell phone, but there are no data which conclusively prove that cell phone will cause a cancer. I mean, there is no proper conclusive data to say that it is definitely going a causative agent of cancer. But I think at least in India, people have been using cell phones probably over the last maybe 10 to 15 years, and before that it wasn't available. Most of the times, the use of, the chronic use of these particular new gadgets, what we are talking about, cell phones and things like that, we need a longer time to actually study them and study their effects in humans. So I think that it would be too premature to say that you shouldn't use a cell phone, because there are reports that 1 or 2 patients have developed a cancer because of that. I think it's just a coincidental finding over there.
Okay. And the other question that most people ask is, can an injury really cause a cancer? You explained about somebody who's repeatedly teeth biting his cheeks or whatever it is, which might result in some form of cancer. But I wanted to touch base on this again. Do you think injuries can cause cancers, like somebody falling from a bike or somebody falling from or injured while playing cricket or something? Do you think these kind of injuries can cause cancers?
Actually, Shrikant, it doesn't. We don't have conclusive proof, and I can say no for sure that injuries, don't lead to cancer. But there are certain conditions which are brought, to the notice of the doctor due to an injury. Mm-hmm. And, we would say that there is something called as an osteosarcoma or a bone tumor. Okay? So, when people are playing cricket, and this happens usually in a younger age group, these osteosarcomas usually happen before the age of 20 to 25, where most of the population is active in sport. Mm-hmm. So, due to a coincidental injury, when you go to the doctor because, a ball has hit the leg or the knee or something, and the doctor would ask for an X-ray, you would coincidentally find that, yes, there is something which is abnormal in that particular area. And then, they would link, because of that particular injury, I've got a cancer. So it's not true. Injury can, it can basically unmask an underlying disease, but it is not the cause of that particular cancer. It can probably just unmask it. Okay, it was there, and this injury has caused it to be diagnosed at this point of time.
Oh, okay. And you're right now in Bangalore, and you have a lot of this IT crowd and other people who are right now. Bangalore is getting high tech. So stress is a major concern to all of these around the world. The tech working guys or people who are used to it. So, do you think stress can result in a cancer, doctor?
See, I don't have data to tell that stress is going to result in cancer, but obviously, at some point of time, there would be a big study saying that yes, stress is linked to, or stress is going to be one of the causes of cancer. Now, as of now, I don't have any data to say that yes, stress is going to cause cancer, but obviously we know that stress is a cause of a lot of other common illnesses like hypertension or diabetes and heart attacks. But as of now, cancer, I wouldn't say that stress is actually the cause, but I may be wrong. Maybe in 2 years time, you may have a study saying that the major cause of this particular cancer is stress. So as of now, I wouldn't say that.
Okay, thanks. Yeah, and doctor, it'll be awesome. We're almost coming to almost close to 1 hour right now, and thank you very much for being here. And I wanted to really ask you if you can enlighten our listeners on how a cancer can be prevented. What are the various steps that can be taken so that people are vigilant and cautious about this dreadful disease?
First of all, I'd like to tell our listeners is that don't ignore symptoms in your body. The most common problem is that when a particular symptom persists and you don't go to the doctor, that could probably be an undoing of you. So if you probably have a particular symptom which you think could be a cancer, please go to your doctor and get it checked up. The other thing is obviously the grand old advice: avoid excessive alcohol, avoid smoking, avoid tobacco, maintain a healthy lifestyle, do at least a 30 to 45 minutes of an exercise every day, eat at least 5 servings of fruits and vegetables so that you're kept away from colon cancers, colorectal cancers. So this is the advice which I would like to basically give the listeners: is listen to your body and seek a prompt medical attention if you think that there is something wrong, because I think we are our best doctors. If something goes wrong, we obviously want to find out, and I don't think any of us want to wait. In today's life, I don't think any of us are going to wait, saying that okay, I will go to the doctor only after 1 week later, I'm going to find that this symptoms persist. But I think it's better that you go to your doctor early so that your diagnosis can be done early and treatment instituted at that point of time.
Very good, very well said, doctor. And how about a message to people who have already had this cancer treatment recently, and what are the steps that they have to take once they had a cancer treatment done?
Shrikant, what I would like to tell them is that if they've had their cancers, they shouldn't be afraid of that. And most of the times, at least if they completed 5 years of their treatment, they are going to be absolutely fine. Only thing is that they must be in regular examination by their concerned doctors, so that if any of these symptoms symptoms are going to recur early, they can be diagnosed and they can be treated. So I would absolutely tell them that live life and fight it. That's it.
Absolutely, very well said, doctor. Do you think a tumor? Can you little bit about tumor and a cancer? Is it both tied together, or?
No. I'll tell you. That's a very common notion. Now, see, there are certain things like a tumor. Okay, a tumor and cancer is not the same thing. Okay. Now, again, a tumor is a Greek word meaning a swelling. All right. So, a swelling need not necessarily be a cancer. It can be anything. It can just be a benign swelling in the breast, or it can be a benign swelling in on the scalp, like the most common benign swelling which every one of us have got is something called as a lipoma, which is nothing but a tumor of fat. Tumor means swelling in Greek. Okay. Cancer, if you use the word cancer, it means that particular disease or the swelling has a tendency to spread into some part of the body or recur locally after its removal. Then you use the word cancer, and cancer is usually associated with the term malignant. Okay, so the two commonly used terminology in cancer are malignant and benign. If you use the word malignant, then yes, then you're talking about a cancer. But if you use the word benign, then we would say that yes, this doesn't have the tendency to spread, and it doesn't have the capacity to kill a particular patient. So tumor just means a swelling, whereas malignancy means a cancer.
Very well.
Okay.
Got it, doctor. Dr. Zaveri, it's really a great honor to have you today and explaining our listeners about what a cancer is. I think we are indebted for your service today, because 1 hour especially talking about cancers, its causes, its how can somebody take care far ahead of things, and how can people who are diagnosed with cancers and treated take additional care. It's a fabulous piece of information, incredible information, and mind-boggling. So, Dr. Zaveri, we are really grateful from NRI Samai and from all our listeners. Kindly accept our heartfelt thanks for coming on to our show today, Dr. Zaveri.
Thank you, Dr. Shrikant, and wish you all the best, and thanks a lot. Thank you very much.
Thank you.
Yep.
Your time is absolutely valuable, and we really value your time today, Doctor. Thank you very much again.
Okay, Shrikant. Take care. Bye-bye.
Thank you. Bye, friends. This is the show today, and we had Dr. Zaveri live on air, senior oncologist from Manipal Hospital. Dr. Zaveri has got loads of experience, complex surgical cancers, and he has been very skillful in function and organ conserving surgeries for breast, head, and neck, and extremity tumors. And I hope a lot of listeners have got a fabulous piece of information from Dr. Zaveri. As Dr. Zaveri told repeatedly that listen to your body, and your body will give you signals of what kind of problems you've got. And it's time, if you see something weird going on, just visit your doctor. And also Dr. Zaveri has enlightened that each specific case is different, each body is different, each genetic structure is different. So it's good if you find something. Just raise a red flag and then go to the nearby doctor and clear out all your questions from the doctor. There's no need to fear. Just got to get up and then go to the doctor and then find out what's going on. So that's it for today, my friends. It's a fantastic show, and we have a show coming up tomorrow again on lines of medical things. This is a show with Friends to Donate.org. This is related to blood donation. Blood donation. Yep. So tomorrow, my friend. This is fantastic. Thank you very much. For listening. And it is friends.org. So that's the show. And this show that we had the archive, cube.com, NRI Samai, and